Hi everyone in Med 445. This is Group A's presentation on type 1 diabetes. Our clinical scenario covers a 22-year-old woman named Melissa who was diagnosed with type 1 diabetes 11 years ago. She is a healthy, active young woman with no complications from her diabetes. She has no history of hypertension, tobacco abuse, or cardiovascular disease. She is currently treated with Lantus insulin and a rapid-acting insulin called Humalog in bolus before each meal. She has had good control as determined by HbA1c levels averaging 7% over the past 2 years. Now to cover some background information on type 1 diabetes. The environmental factors that often are triggered early in life happen due to immune-mediated process in genetically susceptible adults. When it comes to gender, both girls and boys and everyone in between are both affected to the same extent in young populations. For race and ethnicity, there are comparisons within and between country and regions. The seasonal pattern shows increased cases in late autumn, winter, and early spring. There are a number of underlying factors, the first of which has to do with the immune system. Oftentimes, the immune system will mistakenly attack or destroy the insulin being produced in the pancreas, which results in the production of little to no insulin, which leaves low blood sugar levels. Genetics play a role due to the presence of certain genes which potentially can increase the risk of developing type 1 diabetes. Family history can also increase this risk. There's a slight increased risk if a parent or sibling has type 1 diabetes. Virus exposure, environmental factors again having to do with possibility of type 1 diabetes increasing the farther away from the equator you get, as well as age occurring at any age, but it rises within the ages between 4 and 7, as well as 10 and 14. When it comes to managing type 1 diabetes, it requires that you check your blood sugar regularly, which your healthcare provider will provide details on how often to check and the individual's target blood sugar level. This varies by person, so it's important that you check with your healthcare provider. Through the use of insulin shots and or an insulin pump, this manages blood sugar levels and produces the energy that the body needs. The dosage is prescribed by healthcare providers, depending on the individual again. Managing your stress levels is also a crucial part of managing type 1 diabetes. Typical life stressors or daily diabetic care stress can be discussed again with a healthcare professional. Similar to managing stress levels, maintaining a healthy lifestyle is also crucial, and this can include a healthy diet, staying physically active, controlling your blood pressure, and controlling cholesterol levels. Typically, the condition is addressed negatively because when people think of diabetes, most only know of type 2 diabetes, which occurs because of lifestyle, whereas type 1 is an autoimmune disorder that often shows up early in life and is because of genetics, whereas type 2, again, is because of lifestyle. Type 1 and 2 are two separate diseases, but that deal with similar things. For Melissa's behavior change plan, she is going to maintain an A1C level below 8%. She is going to make sure she is active for at least 30 minutes per day. She's going to take 1 unit of Humalog for every 7 carbs and a correction of 150 for blood sugar. She's going to take 28 units of Lantus nightly, and she's going to stay on top of getting eye exams regularly, which is around every 3 months. Melissa will be encouraged to change her behavior using the various healthcare models, from eating habits to monitoring and maintaining her sugar levels. The healthcare provider will be using motivational interviewing and designing a personal plan around Melissa's input as well as the providers. By using motivational interviewing, this will help her to increase her self-efficacy and to make a sustainable, healthy lifestyle. As her healthcare provider, it is vital to make sure Melissa understands the importance of her cooperation. Type 1 diabetes does not have a cure, but with a healthy and controlled lifestyle, it can be maintained, and Melissa can have as normal a life as possible. To help Melissa with her plan in managing her type 1 diabetes, it will be important for her healthcare provider to implement the use of motivational interviewing. This will include using the RULE acronym. Resist the writing reflex or the urge to fix Melissa's problems. Arguing for the behavior change to occur in a patient can often have a negative effect. Understand Melissa's needs. The reasons for change are most important because these will most likely trigger her behavior change. Listen to Melissa. Motivational interviewing involves as much listening as informing. Empower Melissa. Convey hope around the possibility of change and support her choice and autonomy. Motivational interviewing is all about the patient leading her own health journey with the help of their provider guiding them. It is collaborative, but is up to the patient, who in this scenario is Melissa, to determine how she would like to go about continuing to manage her type 1 diabetes. This is shown in an article written by Christine Shannon. They discuss an idea regarding a gap between the ideal that we often see and a reality. On the outside, we can often see an ideal, whereas the reality is often very different. There's a gap between what people know is right and what they actually do. It states that individuals are faced with conflicting motivations and pressures. The change feels too big, the rewards too distant, the personal or financial costs too high, or maybe it was never their idea to change in the first place. This is where the idea of rule and motivational interviewing comes into place. The social ecological model will be used to understand the greater effect of how Melissa's surroundings and relationships will have on her well-being. In order to provide the utmost success in Melissa's care plan, Melissa came up with the idea of asking her close friends to go for walks with her on Tuesdays and Saturdays to help motivate her to stay active on at least 2 days out of her week. This holds Melissa accountable to not only herself, but also to her friends, while also providing her a solid support system. Not only that, but it keeps her active, which was part of her healthcare plan. The health belief model is important for Melissa because it will require her to rely on self-efficacy as a tool in the management of her type 1 diabetes. This will mean setting herself up for realistic goals so that wins can happen, therefore creating a better chance for success. Getting consistent eye exams every 3 months will help to make sure she is not at risk for any retinal diseases that can be risk factors for young people who suffer from type 1 diabetes. In order to help support her with this, her healthcare provider or optometrist can provide cues to action, such as sending out reminder texts or emails every 3 months before she is due for her next exam. The goal of designing a treatment plan with Melissa is to make sure she feels encouraged to change her lifestyle, incorporate daily activities to make it easier for her to live with her diagnosis. It is imperative for Melissa to understand the seriousness of her problem as there is no cure. This plan addresses the challenges through encouragement, understanding, and support, all of which is incorporated into her daily life. For this plan to work and for it to address the challenges, she will have to exercise daily, whether that means walking outside, using the treadmill, or dancing. Anything that gets her heart pumping for 30 minutes each day will benefit her greatly. The support from her loved ones will help her with this behavior as they can walk with her to motivate her. She will have to check her blood sugar with every meal. This will help her to maintain her blood sugar level. She will have to carry her testing kit with her in order to make sure her glucose level does not go up or down. She will need to take her medication every night, which she cannot miss. In order to make sure she does not miss this, she can either set a reminder or her family members can also help her maintain this routine. Thank you so much for your time. I hope you enjoyed our presentation on type 1 diabetes.